Hey, I'm Dr. Bob Payne, a veterinarian at SouthKendall.com. Let's talk about treating allergies in small dogs. Some dogs, like smaller breeds, tend to get an asthma-like reaction, and it could be allergies to something in the air. Sometimes it's seasonal. If it's seasonal, it's probably an allergic reaction to something. It's a pollen or a dust or something, or mold that's in the air. Sometimes we use antihistamines. Sometimes we use what we call nebulization. Allergies usually in dogs manifest with cutaneous problems. They inhale it or through their lungs or through their skin, and they develop allergies that make bacteria and yeast become more plentiful. If it's an allergy that's affecting their respiratory tract, oftentimes it aggravates already predisposing conditions like COPD, chronic obstructive pulmonary disease. We see that a lot with smaller breeds, collapsing trachea. They get pulmonary hypertension. So these are things that you need to define again with your veterinarian and find out if it's truly an allergy or some sort of other problem. Sometimes what looks like allergies in these small dogs is actually sinusitis secondary to maxillary dental disease. And sometimes the roots will cause inflammation in the sinus and it'll look like an allergic reaction when in reality it's a bad tooth. And sometimes if I look from the mouth, the gums up, you'll see a tooth that's bad, and you pull the tooth and put them on antibiotics and they get rid of that infection in that sinus. But you need to define it. You gotta be really careful because with chronic allergies, they get secondary problems that are worse than the allergies themselves, and they can lead to pulmonary hypertension and collapsing trachea, which is really, really tough for them.